This is a meeting that has a lot of solid tumor biology and solid tumor clinical therapy. As a hematologist, I'm also very interested in what's going on in leukemia. And there's so much going on now in acute leukemia, in AML in adults, 2 exciting trials, and also in CLL. There's been a lot going on. And I'm very much looking forward to one of the plenary sessions tomorrow of a monoclonal antibody therapy for multiple myeloma. Multiple myeloma is another disease where we've made great progress even over the last 12 months.
Can we come back to AML for a second? What are you looking forward to there?
There's a very interesting result that's come out of a medication that combines 2 drugs that have been given for 4 decades to treat AML. One drug called cytarabine or cytosine arabinoside and another daunorubicin. And this is a liposomal formulation of these 2 drugs in a fixed dose. And surprisingly, the data looks much better than when the drugs are given separately. And so we've been trying for decades to make advances in treating AML in adults, and this looks like it may be one of the first ones that'll have broad applicability.
And on CLL, you mentioned there were developments there.
So CLL, there's been a wealth of riches. Oral agents and new monoclonal antibodies, and people are being treated now for some very difficult to treat CLL. CLL, for instance, with p53 mutations tends to be what we call a bad actor, to have a poor prognosis. And so some of the data with ibrutinib looks like it's going to make a real difference for people's lives who have poor risk CLL. Now we have to figure out how to combine the different drugs, and that's the challenge for the field right now in CLL. But lots of new agents that affect signaling, the aberrant signaling in CLL, things that are either at the B-cell receptor level, like ibrutinib, and things that work downstream of BCR.
And lastly, you mentioned the monoclonal antibody for multiple myeloma.
Yes, so daratumumab has been FDA approved for treating advanced myeloma, and we look forward to hearing of the movement of daratumumab more upfront in combination with sort of what is one of the standard therapies, which would be an IMiD and steroids. And so lenalidomide and dexamethasone with and without antibody.
Well, with these upcoming results in mind, is there anything that you think is going to be especially exciting for the near future, or something that you'd like to see in the next few years, in the next few ASCO conferences?
Well, one of the important areas in the heme malignancies has been how do you introduce immunotherapy. I heard this morning a very nice talk about combination immunotherapy of non-small cell lung cancer, and for a variety of the solid tumors, the approach has worked very well. In lymphoma, this works well because of a genetic deletion and overexpression of the PD-L1, so that the antibody works extremely well in lymphoma. But we're still trying in the myeloid malignancies and a few other conditions to introduce immunotherapy that could be effective. CAR T-cell therapy is the other, chimeric antigen receptor T-cells, which work in the lymphoid malignancies. There's some evidence they work in solid tumors, and we're still struggling in the myeloid malignancies to identify a good target.
Is there something that you'd like to say in conclusion to wrap everything up?
So in conclusion, I think it's a very exciting time to be in the field of oncology research. We are introducing precision medicine, one, to understand the tumors, but also to understand what combination of therapies may be most effective in specific situations.